If you feel a pain in the knee kind of right in that area where the knee bends, and you also feel a pretty consistent click in that area every time the knee passes a certain range of motion, and if that pain increases every time you fully straighten your knee, or every time you fully bend your knee, then you may be showing some hallmark signs of a small meniscus tear. In your knee, kind of right where it bends, you have a meniscus on either side. They can kind of be thought as nice smooth pillows that not only provide cushion for the knee, but also allow that knee to glide nice and smoothly. When you have a tear in one of your menisci, what happens is that tear can create a rough patch in an otherwise smooth area. And that is exactly what leads to the pain, the clicking, and the pain at end ranges. But before you freak out, because I know this sounds scary, small meniscus tears actually do very well in physical therapy, and studies suggest that in the long term, they may actually do better in physical therapy than they do following something like surgery. And whenever I get a meniscus tear patient in the clinic, I start them all with the very same exercise. It looks just like this, and the goal is to bend your knee all the way and then straighten your knee all the way. And while it may start off as slightly uncomfortable, the goal is that the more you do, the easier it becomes. The thought is the more you take the knee through that range of motion, the more you begin to flatten that meniscus back out and give it a chance to heal. I'll normally suggest that they do that for 3 sets of 10 multiple times a day, and as symptoms start to reduce, we start to build into all kinds of different exercises.